demonstrating, I'm going to do a heart and lung suscitation on the dog here. So this is Bishop. So first I'm going to start listening to the heart. So the best way to listen to the heart is right under the left elbow. And I'm going to take this pulse while I'm listening. So to take the pulse, you could either count for 6 seconds and multiply it by 10, or for 15 seconds and multiply by 4. I'm going to count for 6 seconds and multiply by 10. So I got a heart rate of around 110. And I'm just going to listen to the heart for any arrhythmias. So the heart should sound like a lub-dub, lub-dub. Any other sounds like that, if it skips a beat, a lub-dub, pause, lub-dub, lub-dub, anything like that. Change weird sounds that are different than the lub-dub can indicate a heart arrhythmia or murmur, which is problems with the valves in the heart. So I will listen very closely, see if I hear any of that. I'm going to check the lungs. So they have several lung fields. So I'm going to make sure that I check all of the lung fields, starting on my right side. So I'm going to make sure I'm listening to any crackles or wheezing. These could indicate pleural effusion. It could even indicate upper respiratory infection or pneumonia infection in the lungs. So I'm going to make sure I listen very closely. I'm going to start on the right side. Actually going to take respiration rate, which is the same as the heart rate. Every time a breath in and out is one complete breath. I'm going to measure it for 6 seconds, multiply by 10. Okay. His heart rate is around 30. He is shaking a little bit. I'm going to make sure I listen very closely. Cranial and caudal. I'm not hearing any crackles or wheezing. Left side. Hearing any cracklings, no wheezing, nothing like that indicates anything to be of concern. So he definitely is a healthy candidate for surgery. His heart and lungs sound great. No murmurs, no arrhythmias. Okay, so I will be doing an Okay, so today we'll be doing a pre-surgical electrocardiogram on our little puppy here, just to check for any arrhythmias before our procedure. So I have my leads here. I have 4 leads. So the first one we do is our white lead. So this goes on her right arm, her right front arm, just above the elbow. Actually, if you want to come, just show how I'm attaching them. above the elbow. So we say white on right. I know, you're okay, Michigan.
Okay.
And then snow over grass, our green is on our right hind. There you go, just above the knee. Good job. And then for our left side, we do smoke over fire. So our black one is gonna be on her left front. I know, it's okay, Mama, it's okay, it's okay. You're being a very good puppy. Oop. And then our left on our left hind. I'm sorry, our red on our left hind. And I will spray all of them with alcohol. This just helps the connection. No, you're very good. I know, it's okay, it's okay. You're doing great. And then I'll record our ECG for 1 minute. And here's our ECG reading. So we will record it for 1 minute and then get the best view. And I will discuss the results after. Okay, so to prevent any artifacts during our reading of our electrocardiogram, typically we do make sure that our patient's in right lateral recumbency with a towel because any metal actually can interrupt the ECG leads. We do spray the ECG leads with alcohol to part the fur. The fur definitely can have an impact on that. Any heavy panting can definitely cause an artifact or a few jumps in our ECG reading. Yeah, and that's about it. So here is a picture of our electrocardiogram. So this actually measures the depolarization, repolarization of our cardiac impulses. So as we see here, we have our PQRS complex. So here we have our P, then we have our, go back, then we have our Q, R, S, and then our T over here. So here's our full, oops. Here's our screenshot of our electrocardiogram. So this is what we will go over before our pre-anesthetic procedure, just to check for any impulses that look abnormal. Okay, so now I'll be demonstrating the use of a rabies restraint pole, just in case of a rabies suspect. So the first thing I would do, so as you see this, the arm here bends, and then the end gets smaller or larger. So when I have the big pole right now, I'll put it directly over our patient's head and then pull our pole here. And in this case, I can move, you go with this line. I can move our pet wherever I want him to go. I know. Just like this. And then to release him, I'll move our pole down and then slowly take it over his head. That's the use of a rabies restraint. I will be showing you how to catch urine from a dog. This is Ruby. She will be helping us today. So I'm going to put her down. The instrument I will be using today is a vaccine tray. Other things you can use at home are just plastic Tupperwares. Urine samples are very necessary in veterinary hospitals for urinalysis, urine cultures, and tests like that. So let's see if we can get her to pee for us.
She goes.
Good girl. Nice and easy. Good. Good girl. See, and just like that, we got a urine sample, and we're all set. Good. Okay, so I just wanted to stress the importance of obtaining a midstream urine sample when taking a free catch urine sample. So the importance of doing the midstream sample is because there is a lot of bacteria on the outside of either the vulva or the prepuce that you're obtaining the sample from. So we want to allow this bacteria to be flushed out before we obtain that sample. If we do get the initial stream, then we will get that bacteria in our sample, and then we can get a false positive in our results, which will give us inconclusive results in our urine culture or our urinalysis. So it is very important at least to let the stream flow for 1 or 2 seconds, possibly even 2 or 3 seconds, before obtaining your midstream sample. Okay, so I will be demonstrating using accelerated hydrogen peroxide how to properly disinfect a cage. So for this cage, in all of our cages, we do have 2 sides to the door which have to be disinfected, as well as 5 sides to our cage, which includes our left side, our right side, the top, the bottom, as well as the back. So make sure that you properly spray each side. And the top, the bottom, as well as our cage doors. So accelerated hydrogen peroxide does have a contact time of 5 minutes. So I'm going to set my watch for 5 minutes and be back, and I will wipe it down. Okay, so now I'll be wiping the cage down after we disinfected it. So first I'm going to start with the top of the cage, which is the cleanest. Making sure I get every corner. And then moving on to the sides of the cages. In the back of our cage. And then lastly, at the bottom of our cage. Great, and then I will also wipe down our cage door. I'm just going to get some more paper towels. Wipe down the outside of the cage. Easy me. Good. And then make sure I'll get our cage doors here, the end of them, and their locks as well. Okay, that's how you properly disinfect a cage. Okay, so I'm prepping to do a urinary catheterization. So here are everything that we'll need right here. So I have my sterile gloves that our veterinarian will be putting on. So I'm starting just opening the edges like this. And then unfolding it only with the edges, making sure not to touch the sterile field. Top, and then the outsides using the tabs. Sterile lube, so I will put right next to my gloves. Great. And then I will hand the veterinarian the catheter. Yes. shaved, but I will prep and scrub.
Oh, I thought it was better though, that's why I put it there.
Okay, now I'm going to extrude the penis. We'll be placing a 3.5 French size catheter in. Great, now she's just going very slowly into the urethra, into the bladder.
Try to hook it up and see if we have some
And then
here.
There we go, and now we got some urine. You can see it's coming out. Great, and we're pulling very slowly on the syringe. And now we're going to pinch off the catheter and pull it out slowly. Great. Now we could send this sample out as a sterile urine sample. Run a urinalysis or a urine culture. This is Holo, so she's actually been showing signs of a urinary tract infection. So today we're going to do an ultrasound guided cystocentesis. So first we have our trough here, we have our ultrasound over there. Our Dr. DeBrinket, Lauren, who are going to help us out. Dr. DeBrinket will be getting the urine. All right, Mama. See how good you do. Want to do legs towards the wall?
Sure.
Okay.
Hi, baby girl. Good girl. Oh, I know. So weird.
No, you're very cute.
Alright, so we need to swap places actually if we're coming this way. Yep, there we go. Good girl.
So first she's going to spray alcohol. We're going to minimize debris around the area where she's going to poke the bladder. And then if you could can you get the bladder on the ultrasound if you can?
And that's the bladder.
There we go. So she does have urine in her bladder.
That's weird.
Lots of urine, good. Being a very good puppy.
Alright, gonna poke. Put
Good
the needle
job.
into the abdomen.
It's okay, baby. It's okay if it's weird. Good job.
And there you go.
There we go. Okay, so the next test I will be performing is a shimmer tear test. So this test actually checks for the tear production in dogs as well as cats. For normal tear production, it can range typically from 15 to 20. We don't get too worried if it's a little bit below 15, around 12, 13. We would get a little worried if it was under 10, then we might want to apply some sort of lubricant to the eyes every day. Typically, older dogs do have, their eyes are typically a little more dry, so we do take that into consideration. But the shimmer tear test will give us a lot of information. Okay, so I will be doing a shimmer tear test on Miso here. So first I have my 2 strips here. I'm going to bend it slightly just so that it goes directly into the eyelid. So this test will test for tear production in each eye. So gently opening it without touching each end. I'm going to do her right side first. And I'm going to stick the strip right under the eyelid and close her eye. And then and I will keep it in for 1 minute.
Suzu's doing really well, just, a couple of sneezes.
So I'm just going to make sure I go towards the outside of the eye.
Dr. DeBrinket?
Yeah?
Hi, I have Ashley Kerr returning your call on line 2.
Oh.
For Hudson, he was a charity of positive 4.
Okay, thank you.
You're so good. I'm
Okay,
going to look at my watch for 1 minute.
But, so, how long has it had it?
3 days.
Okay. But doing well, just a couple sneezes, no soft stool?
Stools are normal. Did vomit twice in the morning, but Orner thinks it's probably because she went too long without food.
So it's about 20, so that's totally normal.
That's what I
Now I'm
thought,
gonna
but
do
she
the
said
next
that
eye.
it was
You have
off-label
to
until
dog
it's 12 weeks, and I just
Dry
didn't
and
argue
put before
because every
inside
time
the
I
bag for-
know something she
You
does.
want
Poor dog. Online too.
Oh, look at all them tears.
He's 10 weeks.
attention.
No, I said no, we're maybe saying that it's off-label if they're younger than 12 weeks.
Oh. I think it's a bird today.
Yeah.
He's gone.
So that one is around 13, 14, so that is perfect. And that's how you do the Schirmer tear test. Okay, so I just wanted to discuss our tono pen before we use it today. So the tono pen will check for the pressures in each eye. For dogs and cats, mainly the normal pressures for each eye could be 10 to 25. Anything over that, usually over 25 to 30 or 30 and over, could mean that they have glaucoma in the eyes, which is not good, which is something that we would have to treat. So it is very important to check the pressures in each eye. So our tono pen that we have here does not require any calibration. I just wanted to make sure that we know that. So it's not something that we can calibrate on the tono pen. After every use, it calibrates itself. So then we're all set when we need it. Okay, so now I'm going to be checking for pressures on each eye using a tono pen. So first, I have my needle
So
here.
what I'll do is
Sure, so what I'll do is I'll put you on hold after we're
I'm
finished
gonna
talking,
place it
and
in.
then I'll transfer you to the front desk, and then they will get all the pharmacy information for the pharmacy you'd like us to send it to.
We'll go in.
Okay, and then what are your thoughts on seeing the
now, it'll take about
dermatologist?
15-20 minutes to fill.
Perfect.
So
Now that that's
anytime
loaded,
in the next
I'm just
hour.
going to numb her eye with one drop of a touch of cane.
All right, well, we'll see you later on, okay?
It's like a once a day injection for probably like
You're very
2 to
good.
3 weeks, which is why
Are you ready?
come in every day for the
Are you ready,
injection.
girl?
It's rare
So I'm
to
just gonna
launch
push it a
with
few
this
times.
level of resistance. Very
And then the
rarely
pressures
do we
will
get
automatically
a pill
register,
where there are
usually
no
3 to 5.
antibiotic options.
I need to work.
Okay, great. All right, so hang tight a couple of
Right, 13 on her left side. Now I'm gonna be checking her right side. Now I'm gonna check her right side.
Good boy.
He just needs to give us pharmacy information so I can call in a prescription. Yep. All right. Just leave me a follow-up.
And we got 19 on her right
Mine's
side.
so
So the
her
right
eyes.
side for 19 is a little high end of normal. Okay, so today we will be doing a fluorescein stain. So we're going to be checking for any corneal scratches on the eye. So what I have here is an ophthalmic strip. This is the fluorescein stain. We have our ophthalmic solution and our black light here.
So let's start there. And
So the first thing I'm going to do
I'm glad she's feeling
is
better.
moisten the stain,
The heartworm test also was negative. I don't know if you got that message.
because I'm going to want it to drip onto the eye.
Definitely keep me posted if you feel like the pain comes back or if she's still getting sick. But let's see how she does without the transfer. No problem. Have a good day.
Great. Now I'm just going to flush the eyes out.
It's kind of like a.
Oh, you're so white. I'm sorry.
You too.
This is just to get rid of any excess stain.
Red.
There's like bumps
Oh,
in it.
she's all yellow.
Scary.
Bumps?
I think
I
with
have
the,
I have.
You're a good girl.
no, they made the circles from the.
Oh.
I'm just gonna flush it to dry off the first. Now I'm gonna turn the lights off and put our black light on and check for any stains. So this stain will glow if there are any scratches on the cornea.
Sorry, I didn't hear you.
Okay, so now I'm just going to shine the light right over the eye. And I do not see any scratches, which is good. Just like this. And nothing is picking up on the stain. so I do not see any corneal ulcers, which is great. Ready? Okay, so today I'm going to be doing an anal gland expression on Blue. So anal glands are about at 4 o'clock and 8 o'clock around the anus. So I have my equipment right here. So I have my grenade spray, I have my lubricant, I have my gauze, and I have some cleaner. So first I'm going to put some cleaner for the ends. Great. So first I'm going to make sure I put a good amount of lube on my finger because we don't want to cause her any discomfort. You're okay, baby. I know. So first I'm going to do the left anal gland, which I feel is actually quite full. So what I'm actually going to do is just milk it out with my index finger and my thumb. Oh, good job. Very good. As you can see, grossness came out. Just good. Same over here. Very easily expressed. Normal brown liquid, not thick. Perfect. Good girl. Good girl. I'm gonna give her a nice tush cleanup. Great. Do a little spray because the anal glands can be pretty fishy. Okay, I will be demonstrating how to do a enema. So the first step I have here, so I have a little warm water. We have our lubricant. So I'm going to add a very good amount of lubricant to this solution. Make sure that I mix it in there really well. Using my tongue depressor, I'm just going to mix the lubricant together. Okay. Now I have a catheter. So this catheter will be put into the rectum. So the sizes I have here are 12 and a 14. So specifically for this catheter, we also have a 30cc syringe. So how the enema will work. Our syringe will attach to the side of the catheter. The doctor will then suck up our solution. Probably will do the whole syringe, about 30 cc's at first. This will be placed into the rectum, and we will slowly insert our solution into the rectum, which will moisten and lubricate all the fecal matter that is in the colon that will help and slide it out, which is the main purpose of the enema, and then this will relieve our constipated animal. That is how we will perform an enema. Sometimes pets do need multiple enemas throughout the day to get all the fecal matter out. Sometimes they only need one enema, depending. Typically, our doctors will do a few syringe fulls worth of the solution to allow proper lubrication. Okay, so I'm going to demonstrate how to apply a proper flea and tick medication. So this is a topical medication for cats. It's called Revolution. So the weight range is between 5.1 and 15 pounds, and he is around 9 pounds. So the first thing I'm going to do, I'm actually just going to wear gloves, so I don't touch any of the topical medication. Nothing's happening. Just going to take it out of its little box here. So now for this, it actually has a little push pin, so I'm going to push it at the top. And now what I'm going to do is I'm going to part the fur right in between the shoulder blades. The main reason why I'm putting it here near the shoulder blade region is so that he can't lick it or scratch it off. Okay, so I'm going to go ahead and part the fur right here. Place around the skin. Usually they say about an inch or so. Good. There we go. And then we'll just make sure we're not going to give him any waterless shampoo baths or anything in the next 24 to 48 hours. Now he's good. He's protected against fleas and ticks for 1 month. Okay, so I will be demonstrating how to do an ear cleaning today on Miso. So I have here is just a regular ear cleaner, Vetco, and I have some cotton balls. So the first thing I'm going to do is soak the cotton balls with the ear cleaner, Put a decent amount on. So although it is fairly hard to hit a dog's ear canal since it is L-shaped, I'm not going to use any Q-tips because I wouldn't want to damage the eardrum, God forbid. So I'm just going to put the cotton ball directly in. Tammy, if you want to turn. There we go, that's better. And give it a little squeeze. Just like that so the ear canal fills with the solution. And then I'm going to wipe it out. Oh, you're very good. And I'm going to wipe it out with a dry cotton ball. Good job, Yuzu. Just a little debris. All right, one more, Mama. So I'm going to do the same thing with the other ear. Put the cotton ball in that's infused with the ear solution. Give it a good squish. And then wipe it out with a dry cotton ball. It's very important to make sure that we really dry the full ear canal so that they don't get an infection. Okay, there we go. She's all clean. Okay, so now that we cleaned Yusu's ears, I'm going to apply a little ointment. So this is Quadratop, just a little antibiotic. So you don't need too much of this, just make sure you infuse it in the ear canal. Just a good squeeze and give it a good squish. And then the same with the right ear as well. Just give it a good squish. Great. Now this would be twice a day for 7 days. Okay, so today we'll be doing an ear cleaning on our hospital cat named Captain. He's been scratching at his ears quite a bit. So he does get a little wiggly, so Rachel, who's my proctor, is going to put him in a little kitty burrito. You're a good kitten. You know, Captain. Okay, so the first thing I'm going to do is infuse a cotton ball with the ear cleaner. So I'm using Triz Ultra here. And then I'm going to put the cotton ball in his ear. Just give it a light squeeze. And now I'm just infusing the liquid deep in the ear canal. I am a kitten. Good job. And then I'm going to wipe it out with a nice dry cotton ball. So I am going to use a Q-tip, but I'm only going to use it for places that I can see. I'm not going to go too far deep into the ear canal. Oh, it's okay. I know, Captain. You're okay. You're a good cat. This one actually. Alright, one more ear, my love, and then you're done.
Bye-bye.
And now I'm gonna clean the other ear. The same method. Oh yeah, this is a gunky one. Wipe out any excess debris.
Yeah, I thought of it too.
Yeah, I did. And then I'm just gonna use a dry cotton ball. It's pretty gunky in there. So I am gonna use some Q-tips just to get the debris out. It's okay. It's okay, Captain. Alright, good boy. And then I'm just gonna dry it out. And that's it. Is my sheet in there? Okay, so we took a look at little Captain's ear cytology. We did see a little bit of an ear infection. So I'm gonna apply an ointment to the ear. So it's only going to be about a few drops. So I'm just going to stick the nozzle directly in the ear. And give a good squeeze. No, it's okay. It's okay. It's okay. It's done. It's done. And just give a good squish. It's okay. I'm sorry. I'm sorry. And he's done for now. Okay, so today we're going to be doing subcutaneous fluids on Louie. He's a bit dehydrated because he's had lots of diarrhea and he's also been vomiting. So I'm going to do 400 ml of fluid. So on the bag right now, we're at the 4. So I'm going to go down to the 8. 100, 200, 300, 400. So first I'm going to change my needle. I'm actually going to do a little tenting effect right here. And right where my finger is, I'm going to poke. That's how I know it's a subcutaneous region.
I love you too. I hope
All right,
you
ready?
I hope you go happy area.
And do.
Oh, you little
Good boy.
Oh my God.
And I'm going to open the line. And then watch it fall. There we go. Okay, so now that we have finished the fluids, I'm going to cap off our line here.
This is definitely right
Push
for
it
her?
down.
Okay. Let me just leave that for now. I'm just gonna show Peter.
I have some gauze and I have my needle.
So
cap.
I'll send this.
First, I'm going to put some gauze on. Just slide
So
the
you want me
needle
to
down.
once I show?
Chris is going to apply some pressure so she's not bleeding.
No, Dr. Love changes twice a day.
And then cap the needle. And then we're done. So this is the supplies I'll be using for a nail trim. So here we have our 2 nail trimmers. So the first one is could be for medium-sized to large dogs. And these particularly we use either for cats or for smaller puppies. And then I also have my quick stop solution. So this is what we use in case we do get the quick. It is in powdered form. So if the nail does tend to bleed, we'll put a little powder on it. We'll stop the bleeding. And then we have silver nitrate sticks. So this would be cauterizing. Our silver nitrate sticks, that is in case we cut the nail really short and the bleeding won't stop. Our veterinarians will use this as well. So this is the supplies that I use for our dog and cat nail trims. Okay, so today I'm going to be demonstrating doing a nail trim. So here on Misu, she actually has white nails, so it's fairly easy to see her nails. So the pink is the blood supply, so that's called the quick, so I don't want to go anywhere near that. So I'm just going to trim the white edges. Go, you good girl, Misu. Aw, you good girl. I know, it's very annoying. Do you feel one?
I'm like, it's a bump.
Probably.
Freaks on me.
You're so good. Oh, you're fine. It's okay, it's okay. We get you, didn't it? Her back ones are very short. Okay, and that's a nail trim. I'm going to be demonstrating how to trim a cat's nails today. The instruments I'm using is a nail trimmer and quick stop. So this quick stop is just in case we accidentally get the blood supply, which I will show you is right here in the kitty. If you just push on this digit here, you see that long nail coming. I know, sweetie, it's okay. And if you part the fur, you see that pink right there, that is their quick. And you don't want to get anywhere close to there, so I'm just going to be trimming the clear part. Really fast for you, love. I know, kitty, I know, you're okay. Good, kitty. You're good, all done. Okay, I will be demonstrating the application of emergency bandage. So say our patient came in and somehow got in an accident, whether it be a dog fight or anything like that, and we are waiting for the doctor to come in, we want to stop the bleeding. So I have a Teflon pad here and I have some gauze. So this is going to absorb the blood under my bandage. I'll place it directly on our wound here. Then I'm going to use vet wrap. So for the vet wrap, especially since it is an emergency bandage, we do want it to be pretty tight because I do want it to stop the bleeding. Not too tight where it's going to affect our patient's breathing. application of emergency bandage. So as you can see, this gauze will stop any of the bleeding, and now we can wait until a doctor could come and examine the patient. Okay, I will be showing placement of how to do a modified Robert Jones bandage, including a splint. So we have our splint here. So the first step I'm going to do, I have my tongue depressor. So first I'm going to take the patient's palm. Make sure my tongue depressor is here. So the whole point of our tongue depressor is to make sure that we do not wrap our toes up. The distal end of the toes must be kept open and have room to breathe, so pressure does not build up under the bandage, and that if there's any signs of swelling, that we will see them through the foot. Perfect. So first I'm going to start with our cast padding. Making sure that I keep the toes out. And making sure that I'm overlapping 50%. Now for the cast padding, it doesn't have to be too tight. Just want to make sure that it fits firmly, it's not too loose. I'm going to go ahead and do 2 layers. Great. Our next step is our gauze. So now for the gauze does have to be a little tighter. Not too tight to cut off circulation, but make sure that we are stabilizing the leg. Once again, I am going to do 2 more layers. Bandage scissors. Now that we have our gauze, I'm actually going to take our 1-inch tape. We're going to release our tongue compressor. Wrap it around. Take it right on here. Seam at the bottom. Now we know that our toes are exposed, which is great. No, I saw you. You're very good though. Okay, perfect. Now I'm going to place our splint, and then I will place the vet wrap over. Okay, so now that we are stabilizing our ankle here, going to take our splint. Very good. Now I will take our vet wrap. You okay, Coma? You can come in. Don't worry. Vet wrap isn't too tight. I'm overlapping 50% as well. Now I'm just going to apply a little elasticon so he won't slip and slide on the floor. Just right around the edge of the ball, making sure they don't get the elasticon on the hair. Perfect. Okay, I will be showing the removal of the bandage now. So the last thing I put on was the elasticon, so I'm going to take that off first. I know that wrap is coming off as well with it. If any elasticon did touch the skin at any point because of movement or playing or anything like that, it's always good to use a spray such as Ease Off, something like that, so the sticky part, the adhesive will melt off, so the patient will be in less discomfort when you remove the bandage. And then we have our splint here, which I will remove. Our 1-inch tape. To even speed up the process, you can use your bandage scissors as well, just to make sure. Always make sure that you feel the other end of the bandage scissor, because you definitely want to make sure that you're not touching anywhere near the skin. Removal of bandage. Okay, so we have our trowel here. We're going to go ahead and do some dental radiographs. So the first thing I'm going to do is the maxillary upper incisors. So I have my plate here. My center plate. Just going to put it gloves on, you're going to exit the room and take your radiograph. Great. Now that we got the incisors, I'm going to move and go ahead and do the canine. A little further back for the canine too. Great. Alright, so we're going to go ahead and snap that shot. And I'll show you how our radiographs came out. So we have our maxillary incisors here. So as you see, here's our crown and here's our root. So you see the root specifically right here, our blood supply, our jawbone. Yeah, so this was a beautiful radiograph. And then our next one that we took. And here is my radiograph of upper canine. So as you see here, here's the whole crown, and we have the whole root, and we have the pulp right there. So it was a great view. And we also have a few premolars as well that we took a radiograph here. Here we go. Alright, so the first thing I'm going to do is manual scaling. So this is just to remove any loose tartar off the teeth. So for this one, I'm not going to do it harmful at all. I'm not going to do it I'm not going to put a lot of pressure on the teeth. It's just to remove any tartar, which this patient doesn't really have too much. So it's really just to loosen any excess tartar off the teeth before I scale. So I don't want to get too close to the gingiva at all. Just like this. Great, we're going to loosen it up. The back as well. Perfect. All right. Now I'm going to move ahead to do our ultrasonic cleaning. Right. So first I'm just going to test to make sure that we have our water flow. right, perfect. So, for manual scaling, it's very important not to scale the teeth for longer than 10 seconds. So as you see here, I'm not directly touching the tooth at all. So you definitely don't want to touch the teeth directly. You want to use the side of the scaler to scale our teeth. Now I'm not putting much pressure on our teeth because they are very sensitive. And we also want to make sure that we get above our gum line. Just a little bit, not too high. Move on with our next tooth. So it's very important not to scale our teeth for more than 10 seconds because this would cause more damage than good on our teeth. There we go. I'm just going to move on. So I'm getting all the tartar and plaque buildup, which is decreasing the bacteria on the teeth as well. I'm just chipping away at our tartar. Okay. And that's how you scale our teeth using the ultrasonic cleaner. Good. Okay, so now I'll be demonstrating how to polish. So I have my trophy paste here. I'm going to put a good amount on here. So the point of polishing really is to remove not only staining, but also to smooth out the surfaces that we just scaled. So because our brush is going in a circular motion, I'm not going to do that. I'm actually just going to go up and down and press on the tooth lightly. As you can see, just like this. So it's very important to not polish a tooth for more than 3 seconds because it can cause more damage than good. As you see here. So this is going to smooth out all of our surfaces that we just polished, that we just scaled. There we go. Just like that. And that's how you polish a tooth. Okay, so I'll be going over dental discharge instructions today with my preceptor, Rachel. So we're going to create a scenario where her dog just had a dental cleaning that was just a stage 1. So we had no extractions whatsoever. Okay, Miss Lincoln, so Sassy did amazing today with her dental cleaning. We scaled and polished the teeth as well as did dental x-rays. So based off of the dental x-rays, we did see that the roots look beautiful, so we didn't need to do any extractions, which is amazing. So we scaled and we polished, so her teeth look very, very great. Just for at-home instructions today, we're not sending you home with any medication because we don't anticipate her to be painful at all. She might be a little sore just because we did scale those teeth. So if she is having trouble eating at home, we do recommend kind of putting a little warm water in the food or just feeding her wet food. Do you have wet food at home for her to eat?
We feed wet food.
Okay, wet food, perfect. So even if she's having trouble with wet food, you could even put a little warm water in that as well. Okay. Yeah, so for the future, just for brushing her teeth and everything, have you brushed your teeth in the past?
I do it about once a month.
Once a month, okay. So unfortunately, I mean, it's not that you're not doing anything. That's very good. I'm glad that you're putting that effort in. So she's definitely getting used to it a little bit if you're doing it once a month. But you definitely want to do it more regularly because once a month, unfortunately, isn't going to prevent the tartar from building up. So we want to do it at least every day or every other day if you can. Because tartar buildup does occur within 72 hours. I know it's hard, but usually, so we always like to say after a dental cleaning, give them a week to heal and make sure that their mouth isn't sensitive, and then you can start brushing her teeth. So typically, I like to use a gauze square or even a baby toothbrush. So you can wrap the gauze square around your finger and just kind of rub right where the tooth meets the gum line. It's great to do that once a day. Even you could start it at night when you're just hanging out with her at home. Okay?
I'm gonna try my best.
Try your best, good. And then you'll prevent any, we'll make sure that we keep all of her teeth in the future. Okay? So just for other supplements that we have, just to prevent plaque and bacteria buildup, we have a product called Perio Support. So this is a powder that you would actually sprinkle on her food. So for her size, it would be half a teaspoon per meal. So we can send you home with this today if you'd like. This will help the bacteria in the teeth. And we also have these enzymatic chews. So these chews are actually great just for the actual mechanical part of chewing on it, as well as what's in the chews. It actually breaks down the enzymes. So if you like these as well too, you could take these home.
Awesome. Thank you so much.
Okay? Do you have any other questions for me? I think we went over our feeding instructions, our home care instructions.
If I brush your teeth every day, can I avoid getting a dental cleaning ever again?
You might. So unfortunately, bacteria does build up on the teeth. So if you are brushing regularly, you might prevent it. But since Sassy is a smaller breed dog, unfortunately, there's only so much brushing you can do. Because we know we brush our teeth twice a day, and we still need dental cleanings every 6 months. So unfortunately, that tartar will build up. So we'll try to prevent it as much as you can, though. So you will definitely prevent it and definitely save teeth,
Okay.
which
I
is
will
what
try
we
my
aim
best.
to do.
I will try my best.
All right, great. All right, perfect. Thank you. And these are your dental instructions to go home. Everything that I just explained to you is right here on this page.
Awesome. Thank you.